CT's Body and Balance is sponsored by Canada Diagnostic Centres, offering private MRI and CT appointments in as little as 1 to 2 days. Visit canadadiagnostics.ca.
It's World Asthma Day, and in Canada there is still one asthma death every day. Did not know that. Health Specialist Leah Sarich here with why trips to the emergency room here in Calgary are way down.
Yeah.
This is great news.
It's great news. It's wonderful news. So this is one of those great news stories where the people in the field just said, you know, this isn't working. We have to do something. We have to come up with a plan, and they have, and it's working. So this is really exciting. So that's what we're talking about today. So basically, back in 2005, an asthma attack was the second most common reason for kids to go to the emergency room. Second most common reason. Now, it is dropped to the 9th. And that is including the fact that there are more kids with asthma. So this is a dramatic shift, and it's a great news story. So it's dropped down to the 9th reason, even though there's more kids. This is one of these families. This is the BUSBY family. That's Ella. She used to be one of those kids that was at the hospital 7 or 8 times a year.
She would get really bad really fast, and there's nothing worse than driving the city with your daughter turning blue and you don't know what to do.
I just can't breathe sometimes.
What does it feel like?
It just doesn't feel good.
Can you imagine?
That must be so scary for the kids. Yeah.
So scary. Of course it doesn't feel good for little Ella. So she was diagnosed just after she was 2 years old with this condition, but now you see they're managing it. What you're seeing here, that's a nurse educator. Her name's Nora, and she basically walks these families through the whole idea of asthma. They explain how the disease works, and they make an individual action plan for each child. So basically, they come through and they go through this with the family. So avoiding your triggers. And of course, every person's going to have a different trigger when it comes to asthma. So it can be allergies, it could be a cold, it could be stress, whatever the case may be. Then you talk about your medications. So what medications work for you, how often you have to take them. And again, that's going to be different for every person with the disease. You have to check your device and the technique. So is your device working? How are you using it? Are you using it properly?
Is that the inhalers you're talking about?
Exactly, the puffers, you bet. And then follow this action plan. And that was going to give you control. So this is what happens to these families. They don't freak out anymore, right? Because they have all this information. They know how to control things, and this is helping to reduce these visits to the emergency room.
Great.
It's simple education. It's pretty amazing, and it really works, obviously. Yeah, pretty incredible, hey?
That's a great idea.
It's a wonderful idea, really. If we could come up with this for other diseases, that would be wonderful. So what we're really talking about here is this education, and even from the doctor side of things, doctors say they love this because what they're seeing now, that these kids and their families can basically lead normal lives.
I think the biggest thing is to see a patient coming in to emergency 5, 6, 7 times a year, going to ICU, and being able to treat them with the medications, obviously with the education, and have them not come back and see them come back in clinic and say, wow, doc, I can play, I can run, I can have fun, I can, you know, play soccer with my friends. It's great. It's nice to see that.
Which is wonderful, right?
Yeah, of course, kids can be kids.
Kids can be kids, that's exactly it. And Ella's a great example of that. She plays all kinds of sports. She loves hockey and soccer and gymnastics, and she's leading a really normal life. So, and they're just not going to the emergency room like they were in the past. So it's a great news story.
Yay!
Yay!
And there's going to be information on this on your blog, right?
Absolutely, yep.
breakfasttelevision.ca. That is where you can find Leah Sarich's blog. That's cool. Good for
those
kids.
Yes, it is. It's wonderful for the kids and great for the educators and doctors and physicians involved. Come up with a plan.
It gives you power, you know, power over your condition.
It does, and it's the action plan that really makes all the difference. And if you get the people over at the clinic talking about this, I mean, they're so excited about their action plan because it's really rare that often these things actually work.
There you go.